Imagine a moment when your heart, the very engine of life, can no longer keep pace, when every beat feels like a struggle and survival depends on human skill and courage. This is where open heart surgery steps in, where science meets hope and precision saves lives. It's not just a medical procedure, it's a second chance at life. Open heart surgery is one of the most complex and life-saving procedures in modern medicine. It involves making an incision in the chest and operating directly on the heart, often while the patient is connected to a heart-lung bypass machine. Doctors recommend this surgery for conditions such as blocked coronary arteries, heart valve problems, congenital heart defects, or in rare cases, for heart transplants. Although the phrase open heart surgery can sound intimidating, it is a routine and highly successful operation in many hospitals worldwide. In fact, advances in surgical techniques and technology have dramatically increased survival rates and reduced complications over the past few decades. For patients, the thought of undergoing such a surgery may trigger anxiety, but understanding the process can make the journey less frightening. From preparation before surgery to the steps taken in the operating room and finally to recovery afterward, every stage is carefully managed by a skilled medical team. This surgery not only saves lives, but also restores quality of life, allowing patients to return to activities they once thought impossible. Knowing what to expect can help patients and their families face the experience with confidence and hope. Before undergoing open heart surgery, patients go through a thorough evaluation to ensure they are strong enough to withstand the procedure. This usually includes blood tests, imaging scans, and electrocardiograms to provide a detailed picture of the heart's health. Doctors may also recommend lifestyle changes, such as quitting smoking, reducing alcohol intake, and eating a heart-healthy diet in the weeks before surgery. Mental and emotional preparation is equally important. Patients are encouraged to ask questions, discuss concerns with their surgeon, and even attend counseling if anxiety feels overwhelming. Hospitals typically provide instructions about fasting before surgery, medications that need to be stopped, and exercises to practice breathing more effectively after the operation. Family members are often involved in the preparation process, as they play a vital role in providing support during recovery. Understanding the risks and benefits, as well as what will happen step by step, helps patients feel more in control. By the time surgery day arrives, most patients have already built a strong partnership with their medical team, which can make the process smoother and less intimidating on the day of surgery. Patients are taken into the operating room, where anesthesia is administered to ensure they remain unconscious and pain-free throughout the procedure. The surgeon begins by making an incision down the middle of the chest and carefully separating the breastbone to access the heart. In most cases, the patient is connected to a heart-lung bypass machine, which temporarily takes over the heart's pumping function and keeps oxygen circulating through the blood. Depending on the reason for surgery, doctors may perform coronary artery bypass grafting, CABG, heart valve repair or replacement, or correction of congenital defects. Each step is carried out with precision, often lasting between 3 to 6 hours. During this time, the surgical team constantly monitors vital signs and adjusts techniques as necessary. Once the procedure is complete, the surgeon closes the breastbone with wires and stitches the incision. Though the idea of opening the chest may sound overwhelming, these steps are standardized and highly practiced, making them safer than ever before. Patients are then moved to the intensive care unit for close observation as they begin the first stage of recovery. Recovery from open heart surgery is a gradual process that begins immediately after the operation. In the intensive care unit, patients are closely monitored for heart rhythm, blood pressure, and breathing. Most patients remain in the ICU for 24 to 48 hours before being transferred to a regular hospital room. Pain management is carefully controlled, and patients are encouraged to begin moving, sitting up, and even walking short distances within a few days. Breathing exercises are taught to prevent lung infections, and physical therapists may assist in regaining strength. Emotionally, patients can experience feelings of fatigue, irritability, or sadness, which are normal and often improve with time. The hospital stay usually lasts 5 to 7 days, depending on the complexity of the surgery and the patient's overall health. Once discharged, recovery continues at home, where patients must carefully follow medical advice regarding medications, wound care, and activity levels. Although the road to full recovery can take weeks or even months, steady progress is a reassuring sign that the surgery has succeeded. Support from family, friends, and cardiac rehabilitation programs greatly improves both physical and emotional healing. Life after open heart surgery often brings significant improvements in health and daily living. Patients who once struggled with chest pain, fatigue, or shortness of breath often find themselves able to enjoy activities they previously avoided. However, long-term success depends on making lasting lifestyle changes. Doctors usually recommend a balanced diet low in fat and cholesterol, regular exercise, stress management, and strict adherence to prescribed medications. Cardiac rehabilitation programs provide a structured environment where patients learn safe ways to rebuild strength, improve endurance, and protect their heart from future problems. Follow-up appointments remain critical as they allow doctors to track recovery and adjust treatment plans if needed. While it is natural to feel cautious after such a major operation, many patients return to work, travel, and even enjoy hobbies like sports once fully recovered. Stories of people thriving after open-heart surgery highlight not only the power of modern medicine, but also the resilience of the human body and spirit. By embracing healthy habits and staying connected with healthcare providers, patients can look forward to a longer, healthier, and more fulfilling life.